Good afternoon. HAND is based in beautiful Austin, Texas, where we are helping area neighbors daily. We provide personal attendance services, social work, transportation, and volunteers to the low-income seniors in our community. We serve over 600 individuals in their homes every day. Central Texas is one of the fastest growing senior populations in the country. We have the #1 fastest growing percentage of pre-seniors, and poverty rates among older adults has grown 42% in recent years. We're upon a big crisis. People think of Austin as a very young area, and we're aging very rapidly like the rest of the country. One of the problems that HAND noticed is that we have 275 direct care assistants working out in the community, and what we were seeing is that they were experiencing almost as many problems as our low-income clients were. There are approximately 800,000 direct service workers in the nation right now. It's anticipated to pass over 1 million in the next few years. Primarily, they're minority women, have a high school education or less, and are aging rapidly themselves. They're living with economic insecurity and lots of other problems. What we've found out at HAND is the main problem that we're experiencing is that we have a situation where the aging, sick, and poor are caring for the aging, sick, and poor. 42% of our attendants are over age 54, and many of our attendants end up being our clients later on. Some of the common issues that we're seeing among this population, meeting basic needs like food, shelter, and housing, banking issues using payday lending, domestic violence, mental health problems, low literacy, childcare needs. We're just seeing a lot of illness and problems in this community. When we started thinking about how we were going to support this population, a lot of people revert to training, but what our thought is that you have to meet people's basic needs and their emergency needs and their daily needs before we can even move up to those special higher level goals. So we started Aspire, which is a workforce support model to improve client care, reduce turnover, but for us, one of the #1 things was to improve the quality of life for attendants and their families. If we don't take care of these individuals, we can't take care of our clients. So Aspire has many components. We added an internal employee assistance program. We provide free counseling visits to people and have support groups for psychosocial support going forward. We have done financial opportunity and access and information. We have helped our attendants to get banked. We have provided budgeting classes. We work to get people on direct deposit, trying to make their lives easier and helping them with financial management and planning for the future. We've looked at health and wellness, particularly obesity and diabetes management, working on good nutrition, healthy eating habits, exercise, and just making sure that they have access to medical care, helping people register in the Affordable Care Act or other programs. And then crisis management and community referrals. We have seen many situations this year where we had attendants who were living out of their cars, suffering in situations of domestic violence, or having trouble accessing mental health services. So we do a lot of crisis management in-house. And then finally, we move to the education and training. Now, when we've met the basic needs, we can help people move forward in their careers. If they want to move up, we're partnering with other opportunities in the community so they can get their CNA, nursing, social work, however they'd like to move forward. What's great about the way that we did it, we're poor like the rest of all nonprofit agencies out there, and we did it predominantly through collaboration. We added 1 full-time staff member, we use a master's level social work intern, and the rest is done through collaboration. We've collaborated with both for-profit and nonprofit partners. You can see some of our partners here. One of the neat things we did, we created an English at Work model where we taught English as a second language while we taught financial management at the same time. That was free to us by bringing in partners from Bank of America and some other nonprofits. Our employee assistance utilization is 12%, which is over the national average. We've managed to get over 60 individuals banked. We've enrolled 40 in the Affordable Care Act. We gave 50 flu shots last week. And so we've really moved this program forward. We recently created the Central Texas Home Care Alliance. There are over 160 agencies in Austin right now, and our goal is to bring all of their workforces and employees together and offer that same array of services into that. If we look at impacting each individual employee and their children and the people they serve, and then probably their parents as well, the estimated impact in Austin alone is that by serving these direct care workers, we can touch the lives of 42,000 low-income individuals in Austin, Texas. So our goal and mission really is, in order to provide quality care for our clients, we have to support those who provide their care. We all know they're the backbone of this industry. We all know that we need to grow them and support them if we want to be able to do the work that we need to do into the future. If you have questions and you'd like more information about the program, more than happy to provide it. Amy at handaustin.org. Thank you very much.